Okay, so you're both in here. Okay. This is Jennifer and Sean, and I just brought them in today to talk a little bit about Jennifer's experience with peripheral nerve stimulation and an occipital nerve stimulator. Jennifer, how did you come to meet me?
Well, I came to meet you as a result of having had a stimulator placed previously in a different location, and then it was, something was wrong and it was acting up. So, you know, the rep said, here, you know, go here, and so I actually came to you to, you know, fix it, basically.
Gotcha.
So after, go ahead.
Well, what happened then?
After fighting with the insurance company and that type of thing, we went in for a revision or replacement of the nerve stimulator, and I guess you wound up replacing and you know, giving me the new and improved stimulator, and so here I am, all recovered.
Well, let me ask you a little bit about life without stimulation versus life with. So you had the stimulator, it worked pretty well, and then it stopped working. I think you had electrode burnout, and then you had a period of time where the stimulator wasn't working, and you had to live life without the stimulator, and now you got the stimulator back. So what's life with, like with, then without, and then with? So what was it like before?
With the stimulator, I regained my life back, because previously I had been so sick that I wasn't working for about 6 years.
And what were your symptoms?
I had excruciating head pain, migraine, nausea, vomiting, just photosensitivity, and I could never control the migraine, so it was just constant.
How many days a month would you have a headache?
Probably 24 out of 30.
Wow.
Yeah.
And so then you had the stimulator put in, things were doing much better, and then you knew immediately when to stop working.
I did. After getting the stimulator the first time around, it took me less than a year, and I was back to work and working full time again. So that was an amazing recovery. The time that it went out and I was coming to see you and then I didn't have it for that period, it was like going back in time and remembering how horrific everything really was, and losing my, you know, wanting to keep my life together until you could actually fix the stimulator and, you know, have life again. I've been a nurse, I'm a registered nurse, and I'm also in school as a pediatric nurse practitioner, and so I was hoping I could keep, you know, school afloat and keep everything going, and, you know, to get surgery, and I did. So it's great because I have this, you know, opportunity, and I think, well, I should graduate in August. That's awesome. And I'm really excited about that.
Yeah, me too. So now all of a sudden there's a insurance administrator watching for your insurance company, and you had some trouble getting authorization to have this revised. What would you say to the insurance administrator about how important this is?
I would say that with many cases, drugs are not the answer. More drugs don't do anything but make you more debilitated, and you are not functional in society. You're not contributing to society. My frustration specifically this time around was that I already had a stimulator in. It wasn't, I wasn't asking for a new piece of equipment. I was asking for this to be fixed or replaced. And I don't think that that was, you know, a grand request when you already have something, you know, that has proven to be functional and proven to actually make a person able to really live life.
Yes. Now this is not approved by insurances for this application. So
Right.
let's say you're a migraine sufferer. Do you think it's worthwhile to be able to try this?
I do. I think depending on the severity of your migraines and depending on how many treatments you have tried and medications that don't work, that's not to say that those medications don't work for other people, but everyone reacts differently to those medications. If you can't get a medication to control or several medications to control, I think it's definitely worth looking into other avenues, whether it is, acupuncture or, those, other alternatives.
Sure.
But if those don't work, yeah, I would say definitely find, keep looking around and networking and find someone like yourself that's done an incredible job in, giving me a new stimulator, but it's not just the same stimulator. It really is the better, and I'm just incredibly pleased that that this happened, here, and with such a wonderful job done. So I think that people should really look around and don't think of pain management in the sense of what we think of pain management. A lot of times, I think a lot of times people just random that don't understand, pain management as a specialty, just see it as, getting more pills, and there's so many avenues, including the stimulator, that are available to try. And I think, for instance, like, what was it that we did the nerve block before, when I couldn't, function, and we were waiting on an insurance company. Those are phenomenal avenues to be able to use. And I think the general public needs more education of what true pain management is. And, that's my feeling on that. But I would definitely recommend, exploring the options with someone.
How many debilitating days do you have per month now?
Per month now, I would say I'm still in school, and so I'm doing 25 clinical hours plus a 36 hours work week plus a huge travel time.
Wow. So how many hours a week do you work?
On Sundays I usually crash. I can't do much of anything but really rest and then try to get some studying in. But I haven't been, since recovering and going back to work, I haven't missed any work or clinical hours.
Wow.
And
that's great.
It's great. Yeah,
That
it really is great. I think that speaks so much louder than statistics or what is quote unquote approved or not approved.
I agree. It's really where the rubber meets the road.
Definitely. So I just want to thank you,
Thank you.
for going above and beyond. Your staff went above and beyond, getting insurance issues taken care of, and really fighting for my health along with me and advocating, which means a lot to me, even more than coming in and, everyone's, polite and does a great job at what they do in the office, and you do superb work. But above all, this is what medicine should be. And I think what I saw in my case was that it demonstrated to me the reason why I went into medicine and why I do enjoy what I do is because when it works right, it is incredible. It is gratifying, and it really is. And I'm on this end of it, and knowing the other side too it is very special. And I know Sean has been through tons with me, and we have I don't know, I just know that he appreciates it so much, because this type of thing that we're talking about is what gave him his life back to as a husband and a friend, and I have 2 daughters, and it gave them their mother back, which is probably the most